Okay. Good afternoon, everyone. Let's go through some data. A lot of stuff to talk about related to that. And then just take some questions. No new deaths over the last 24 hours, so still at 207 of our residents that have died directly related to COVID-19. Related to testing, we received 1,836 tests back. Our 7-day rolling average is 0.92%. Hospitalizations, we have 19 of our neighbors in the hospital at this time, with 4 individuals in the ICU. We had 4 new admissions and 4 discharges over the last 24 hours. So certainly let's keep everybody in the hospital in our thoughts and prayers as they struggle with this virus. Out of the hospitalizations, we have 13 Caucasian, 3 African American, 2 Asian, and 1 unknown demographics at this time. Looking at overall cases, we have now had 4,579 positive cases. Tomorrow we will probably go over 1% of our population since the pandemic has started with new cases. That's up 31 cases since yesterday. Let's talk about what the data tells us, what's the story behind it. Out of the 31, we have 3 travel-related, 1 international, 1 state of Pennsylvania, 1 within New York, 4 household contacts. Again, a household contact, as long as we have cases of COVID, we'll always see household contacts shortly thereafter, as it's difficult to properly isolate in a home at times. 3 senior facility cases. This is something we're going to watch very closely moving forward when there's a direct correlation with loss of life and senior facility cases. So we're going to be talking about that in a moment. 2 group home cases. We're still doing 2 more cases that are being investigated. 16 community spread, 6 of a known source. So out of the 31, 10 of them are related to higher ed. Out of the 7 of the 10 are related to students. 3 of the 10 are related to out-of-jurisdiction higher ed cases that have come back into the county to isolate. So those transfer in. And that's important, too, when we see the state data. We never report that day's state data on New York Forward because there's a lot of work that happens. The number of cases that the state may put forward for us that day, we may transfer out 20 of those cases to other jurisdictions because they may be students who live who are going to University of Buffalo or going to Fredonia, and those are not Onondaga County's cases. We get them because those students' home addresses is tied to their insurance. So then we report out 24 hours later after we work through all of that. Sometimes that if a student who's from here got COVID at a college and they come here to isolate, that then becomes our case, even though the infection wasn't here in Onondaga County, because we make sure that they isolate here and we make sure that they follow the proper quarantine protocols. And then 4 out of our 31 related to lower education, 3 out of the 4 related to staff. And so diving into more of the numbers, 2,599 have been female, 1,980 male, 513 under 19 years of age, 1,000 in their 20s, 601 in their 30s, 545 in their 40s, 655 in their 50s, 480 in their 60s, 335 in their 70s, 283 in their 80s, and 167 in their 90s. Reminder to the community that there's multiple testing sites, and as this virus begins to get a little bit more complicated now in the fall than where we were in the summer, we will be beefing up that capacity. But there's still the Syracuse Community Health Center. There's still your doctor. There's still Krause. There's still St. Joe's. There's still Water Street at Upstate. And then we have MBT Bank Stadium, where we designate that site to students and teachers so that we can try to expedite that process for them. There's a lot of demand for this, even as we build up capacity and are continuing to build it up. So if you call upstate and you can't get an appointment in your timeline, you can also go to the site and get a nasal swab. And if you can't get to the site, it's easier for you to go somewhere else to get a test and go somewhere else. There is testing capacity here. It's just you have options. So as a reminder, a saliva test, a lot of demand for saliva tests. If you want to get a saliva test for your child, or if you're a teacher who needs to get a test, or a faculty member for a saliva test, one of our lines at MBT Bank Stadium is with Upstate. Call ahead, 315-464-2582, select option 4, or, and this is quicker, you can go to mychart.upstate.edu, register online, set up an appointment. There is demand for the saliva test, so you may not be able to get your child sent home on Thursday because they have symptoms. You may not be able to get in on Friday because of the demand for the saliva test. But if that's the issue and you can't get in on Friday for the saliva test, you can go get a nasal test at MBT Bank Stadium. We encourage you still to pre-register at register.cayugahealth.com. If you just show up, we will still test you, but we will need to input that information. So this helps streamline that process. So those are two of our protocols for symptomatic testing related to schools. On colleges, our colleges are doing school testing already. They're doing screening. They're doing symptomatic testing already. This is for our lower education schools. Asymptomatic school testing will hopefully begin tomorrow afternoon, if not tomorrow afternoon, Thursday morning. This is proactive saliva pool sampling, and we are going to be going in working with faculty in buildings. The first 3 buildings will be Jordan Elbridge Middle School, Seymour Elementary School, and East Syracuse Elementary School. So those will be the first 3 buildings that we go into for saliva pool sampling with faculty. Why faculty? Dr. Gupta and her team of contact tracers analyzed the data. They've seen that most of the cases that we've seen in the building are coming in through the building through adults. That makes sense. Adults go out to dinner. Adults might meet their friends for a drink. Adults are more active. That's where this virus is hiding in our community. So that makes sense. We want to find those asymptomatic cases and stop it, quickly contact trace, and box in the virus where it is. And so, again, this is voluntary. This will be pooled, and this is asymptomatic. Any symptoms, again, we're using MBT Bank Stadium. We talked earlier about our senior centers. We're obviously, we've learned about this virus and how we need to plan and prepare for worst case scenarios. We'll be working with our nursing homes and senior assisted facilities to implement wastewater testing. Why do we want to use that now? It's an early indicator that will tell us if we have a problem. Wastewater testing's value goes away if you know you have COVID in a building. You can be picking up shedding from somebody that's already recovered, but with very few COVID cases in these buildings now, we want to implement this and work with our partners there. So we'll roll that out next week, and certainly this will be helpful for the residents of the nursing homes and the senior facilities, for the staff and the operators, as this will be an early indicator if we have an issue. And then what happens when we find COVID in the wastewater? We come in and we test. The employees are getting tested once a week anyways. This gives us the ability to test all the residents as well, so we can find where the potential virus is hiding in those buildings. And we do this to preserve life. We know that these are our most vulnerable residents, and this will be an effective tool for us to get out in front of this in the fall here, as inevitably there will be pressure once people are in indoors scenarios and settings more. To that, I want to talk about some trends. over the last week of what we are seeing. Now's not the time for COVID fatigue. I know it's tough. I know we're living with this. I know that at times we feel we can let down our guard if we're having a good time. But let me just go through some data points. Although our positivity rate has inched up, we kind of anticipated that. That's not concerning, but we're doing more testing than we were in the beginning. So our number of cases are inching up too, specifically more than the summertime when most of our activities were outdoors and safer. As activities move indoors, this virus can pop up more if we're not smart. So here are a couple trends that drove cases. Obviously, we had a college cluster at Syracuse University. I would say that's our first severe college cluster we had. We feel very good about where we are with that. We think we've gotten our arms wrapped around that. Again, you had 20 cases a day, 20, dropped down. I think we had 6 cases, 14, then like 6, and I don't think we have any to report tomorrow right now. So that 86 cases, those are 86 cases that we didn't have the week before, right? So we didn't have cases. So that's going to drive your data up. We feel good. This is going to happen again. It's about getting our arms around it, right? So we know these clusters will happen. The number 2 real issue which we see, and Dr. Gupta is concerned about, is that people are not staying home when they're sick. And we need you to do that and be smart. My own office, I had 2 deputies, sore throat, they woke up, go get a COVID test. That's what has to happen now. Any symptoms, you need to be sick. We have cases where people went to work with light symptoms. They went and socialized with some colleagues, grabbed some dinner, and then all of a sudden you see some spread. So these are things that are happening. The majority of our cases in the community spread category are people who are sick with symptoms and they're going to work. So please, 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 we work very hard to build up the capacity to test. Please get a test. If you wake up, you're a little under the weather, it's allergies, yeah, it might be, but maybe it's not. And if it's not, you can go into your employer, your place of employment, you can spread it. That can impact your business that you work for, your family. Please, if you're sick with symptoms, get a test. That's what we need you to do. Business complaints are increasing. Again, we've been operating, and we, like anything, when things are new, people follow the rules very well, but then people get comfortable. And you put the business owner in a tough spot if you're at a restaurant and you're standing around and you're trying to hang around the bar. Everybody wants to keep these restaurants open. I would like to get the restaurant capacity open more, but you got to be sitting down, and you know the rules. I don't make the rules. These are the rules, though. And so by putting yourself in a position where people are standing around the bar, no masks, those people call. People call when they're in the restaurant. They complain to the SLA. They complain to us. We then need to enforce the rules. And you're putting the business owners in a bad spot when you're doing that. So please, please, these business owners have gone through a lot. Let's make sure that we're following the rules when we're patronizing these establishments. And if there's every complaint that comes in, we have to do an investigation. And if there's going to be an investigation and people are breaking the rules or they're not enforcing them, we have to take the appropriate measures. And the other thing with this now is we got to do everything we can to eliminate everything else, right? When we dealt with this virus, we dealt with it at the end of winter, beginning of spring. We didn't have to deal with a whole flu season. Now we do. So influenza A and B cases at mid-March to mid-April, we're dealing with probably 100 cases. Now we have a whole season. We're lucky that we haven't seen a lot of the flu yet. That's a good sign for us, but I want to encourage everybody to get a flu shot. I've never had a flu shot. I'm getting a flu shot tomorrow. So I think that we have to take every mitigation opportunity to eliminate any other thing that could look like COVID so that we have less people sick, and that we can get right to the source and continue to tackle this virus. But saying that, happy to take questions.
Do you see the community at perhaps a fork in the road where we can continue on this a little less than 1%, or because of the season change, the comfortability and relaxation of the rules, we could start to see positive cases, the percentage, use the word inch up, but inch up substantially?
Yeah, I think we do. What we do, we've built up an infrastructure, Andrew, that will probably avoid large clusters because we find it, right? And then once we find it, for the most part, people work with us very closely on contact tracing. And that's when you find out the story behind the case. Each case is an investigation. We've had 4,579 of them. So do I think we are in danger of what has happened in Rockland County or Orange County or Brooklyn? No, I do not, because we've built up this infrastructure that's tried and true and tested. But what we do face is that we did very, very well in the summertime. We had this thing down so low that at one point we might have gotten it pretty close to zero. We just didn't get there, right? And so because of that, we get comfortable. And I do sense fatigue. I do sense that, and I appreciate it. I'm tired too with dealing with this. You have other things going on you got to deal with. You want to focus in on in your job, but we can't get tired. We're almost there, right? I think we're in the third quarter now of this. We got to get through, by science, the time they need to get the vaccine, get the therapeutic treatments to treat our sick, and by doing that, we just need to be smarter. And the number one thing we can do now, according to what we're seeing in the cases, is people are going to get sick this time of year. For most people, it's not going to be COVID. But we need to rule that out now, because if it is COVID, out of the 100 people, 8 people are getting COVID with symptoms, or 7 or 6 or 5, and they go into work, indoors, it's going to spread. So that's what we're seeing. Our positive rate, again, we were in that 0.6, 0.8 range. Now we're more in that 0.8, 1% range. We have a cluster in there, so maybe we'll get it back down. But every indication for tomorrow is we're going to have a bunch of cases tomorrow. And Dr. Gupta is telling me it's the same stuff from today. So we gotta just get with it. If we're sick, we got to go get a test. That's got to be the rule.
Andrew, how many nursing homes and assisted living facilities do you intend to start the wastewater surveillance on next week?
Yeah, we'd like all of them to be in the program. So we're going to work with our state partners on that. I'll probably do an executive order related to that. And I think if you've had a couple of them that have had cases, you'll probably wait they'll get implemented last, because you want the wastewater screening tests are now so sensitive that you're going to pick up even small particles of COVID, just like we have. If you remember, a couple of the wastewater triggers went off at Syracuse University. We had recovered students in those buildings, and that's what we were picking up. It wasn't new cases, it was recovered. There's still shedding involved. So we'll get on the call this week with these facilities, explain the program. It's no work to them. We do all the work. And then in the event that there is a trigger, then we're going to go in and we're going to test everybody.
The 3 people now from elder care facilities, what facilities are they? Are they nursing homes? Are they the state run? Are they?
Yeah, I won't go into the specific facility, but it is a nursing home. And we've had periodic cases where you get 1 or 2. Remember, we still got employees going in and out all the time. And we haven't, obviously, over the summer, we had the memory care facility that was really ravished pretty badly by COVID, and we lost many members of our community to that. So that's what we got to avoid. We've lived through this now. We know better now. We have to do everything we can humanly possible to try to keep this virus out of these buildings.
These 3, though, are from the same nursing home?
Correct.
And
I'm not sure if they're staff or residents yet.
Okay. But that's the worst since the memory care example over the summer, the highest number?
We've had onesies and twosies, right? So today's 3, so that might be that might be the highest. But again, manageable if we box this thing in.
And your executive order says these facilities need to take advantage of the county's wastewater treatment?
Yeah,
or-
that's what we made the order. We sent it off to the state to take a look at, see if there's any concerns, and when we get that back, we'll work with the industries. Again, this is a matter of us going in, getting wastewater samples, our teams. It's no work to them. What would be different for them is if we find it, then we need to get in and test the employees get tested each week. The residents don't. So we would then get in testing the residents.
Employees getting tested is still a state order?
Correct.
Okay, and if you saw 4, 5, 6, 7, would you be able to shut down visitation again, or what would your next steps be?
So that would be the state's call. I think some of my colleagues throughout the state have seen some of the nursing home cases start to pick up a little bit. So it's very important that people aren't coming into these buildings that aren't being tested. And certainly finding a balance with families still being able to try to see their loved ones is something that I think is important too for the long-term health of the resident. Again, that was a long period of time for these residents not to see their family. So I think there's a balance here, Andrew. I think what we know is many of these facilities don't have cases now. Let's put in this other layer of risk mitigation into it. And then quickly, if we get a positive, let's quickly get in there, test everybody. And then if we have 1 or 2 positives, remember we have some of the facilities that had COVID floors, COVID units. We get those ready again. We get the individuals transferred out of buildings that don't have COVID floors into buildings that do.
Brian, how many tests can the county do a day? What's the demand like right now?
So right now at the MBT Bank Stadium, which is the one that we're most actively involved with right now, Tony, we're probably doing, 250 a day? Would you say capacity, Dan? Around that, 3, 2? Okay. Yeah, 200 to 250 a day. We're working on that capacity, looking at with Cayuga Med building that out. You probably heard about some of these rapid tests that the federal government sent to the states. The states are now talking to locals about getting those deployed. Certainly, we've asked for a bunch of those. So if we get those, we'll probably bring those to MBT Bank Stadium and figure out the best way to use those as well to bring more testing capacity there per day. But again, Syracuse Community Health, private labs there, lots of capacity. Upstate still has a Water Street location. Kraus, Joe's, doctor's offices, they all still there. So in the community, we've had 6,000 tests done in a day in Onondaga County. So the capacity is there. It's just finding the right spot that meets your schedule when you're searching.
You mentioned NBT. What's the testing turnaround time for NBT right now, and then also the health center and Upstate's mobile?
I don't know what's going on with Quest. I know Upstate's very, very solid related to your 24, 48-hour turn time. MBT Bank Stadium for the Cayuga Health side, they're now caught up. Over the weekend, they got backed up a little bit. Broome County saw outbreak. Their labs are backed up, so Cayuga Health took on a lot of Broome County's testing over the end of last week. That delayed some of the turn times there, but we're pretty comfortable. They're back to the 24, 36-hour times now.
How many tests has the county administered total?
We don't physically administer them. So
how many tests have been?
Yeah, in the county, I would have to look. New York Ford, I think, has a number that probably isn't even accurate because they weren't counting saliva tests for so long. But needless to say, we are probably doing a week somewhere around 25,000 tests a week in Onondaga County with everybody.
Last Thursday, I believe you mentioned you were going to get your COVID test today, and today you mentioned you're getting your first flu shot tomorrow.
Correct.
Did you get the COVID test today?
I did. Actually got it last night.
Last night.
I did. So, and we put a video, Jim, I know when you're bored later today, you can watch this video, but of me, it's the saliva test. So I actually showed how easy it is. So that was done. Again, I have no symptoms. I did this because I've been pestered by one member of the media specifically who's not here today. And so I did that, and it just go through the process and show it online. So I think there's value there. Very good. Hopefully I'll have my result back tomorrow. But again, no, if I had symptoms, the rule is I have to stay home and quarantine for results.
Where did you have the test done?
I actually had it done in the emergency management department.
The dominant topic at the briefing on Thursday was the situation with the mayor's conference. With all the time it was given last week, it deserves follow-up. Has any additional positive case come from what was just the one positive mayor of Binghamton?
To my knowledge, none of the other leaders that were there have tested positive, or members of the media that were there. So I think so far it's just an isolated incident with Mayor David, and I believe he's doing well. So that's very good news as well.
Over the weekend, the county, via conversation with you, opened an investigation into Trex, which had a busy night apparently on Saturday. Any update on what the county's discovered?
Yeah, so I think what we've seen, I can't talk specifically to Trex, but because there is an investigation. We get alerted to these things. You see things, and what we've seen with others is that because we've had other bars and restaurants that have had people waiting to get in because of capacity. So that tells you at least one thing, right? At least it tells you that the operation of the business is probably following a rule related to capacity because people are waiting outside. But the business owner's responsibility during the pandemic does not end at the door. They have to be involved in, if you have people waiting to get into your facility, you need somebody there that will help make sure that there's mask wearing if they aren't distancing, and certainly in some of the video and photo, it seems that there wasn't. So those will certainly be conversations that will be had with any business owner, but we have had similar situations with other businesses that usually we will go in, we'll talk about it based off of how severe of an egregious it was. There could be potential fine, or there could be warning letters. We'll let our investigators work through the process, because I know they are right now.
Ryan, your executive order for gyms to reopen needed the statewide test percentage to be below 1. It's obviously higher than that right now. What does that do to your executive order?
I would have to look at the executive order, but our 7-day average is 0.92. So again, I don't know where people get their data, but I don't think it was below 1. I would have to review the order. But right now, our 7-day average of actual tests performed to positive tests that we keep track of is below 1. So
for statewide?
For our Onondaga County?
No, so your executive order said the statewide percentage had to be below 1, and I think the state's at like 1.2.
I wouldn't have the ability. I would have to look at the executive order, Tony, to see. I don't believe that I signed an order like that, but I'll check. I'll double check on that. But again, we haven't seen cases with gyms. If that's to the specific question about gyms, we have seen cases recently where people who have symptoms are going out and having dinner, and might have drinks with their dinner. But we have not been, in our contact tracing, seeing problems with people sick going to the gym. But we'll look into what exec order we had. I think I did an executive order related to the state has orders related to capacity and mask wearing. I would have to be refreshed if my executive order even is still there, or if it was superseded by a state regulation, which often happens.
I know you mentioned too fatigue of people in general, and that's playing into the increase. Over the summer, the students weren't in school, college kids weren't here. Is that also playing a bigger impact into the numbers? Yeah, I think but we knew that, right? So that wasn't going to be. That's not really, I would say, surprising that you're
putting students in a dorm, it's a similar situation like a nursing home. Is there higher risk there? Yes. Are the students in college there on their own free will? Yes, they are. And then the issues of kids going back to school, it's about finding balance. And I think that's what we've done. Really, if you've looked at it, the first month and a half or so of school, we've seen it all, and we're getting more comfortable with it. The districts are getting more comfortable with making decisions related to this. We're going to have cases, right? So today, I think if we had 31 cases, right, and 31 cases related to schools, I think you'd have to take a look at what's going on and what's the upsides in person, et cetera, et cetera. But we had 31 cases, and 17 of them were related to schools, or 14. So that means 17 of them are community-based cases. So by not going to school is not going to stop COVID. If that was the case, we'd probably have a different assessment. By not going to school will create other health issues that we've seen with our kids. So it's, again, finding the balance, and each district's doing a nice job. Some quarantines are tough. You have students walking around buildings, going back and forth, then the school needs to shut down. Some quarantines are very small because the student was confined, one part of the classroom, direct supervision, or that student was only in class on a day, they were sick, parents kept them home, didn't have a lot of interaction. Each case is different. But we knew there would be more cases when this happened. And again, it's all about our infrastructure's ability to fight the virus. And our hospitals are not overrun. Our health department is not overrun. We had a busier week than we would have liked last week. But again, there will be busy days ahead of us, but then there will be days that we'll have very good days as well.
Who will actually conduct the wastewater surveillance? Is that going to be the county or ESF and SU?
So right now we work, Jim, in our wastewater treatment facilities, we work with Syracuse University. So what we'll do, I don't need the wastewater to tell me we have COVID in every part of the county. It can tell me that, but I already know that based off of the sheet that we're talking about. What the wastewater could tell me is, do we have a new case in a nursing home? So we're going to take that program, transition it out of our wastewater treatment facilities into nursing homes and assisted living or senior assisted living facilities.
So it'll be the building's wastewater surveillance?
Correct.
Like what they're doing at the dorms up at SU?
Absolutely. Correct.
Gotcha. And then if there is a early warning signal in that surveillance that there's COVID in the building, who will actually conduct the tests? Will that be up to the nursing home to make those arrangements?
So what we'll do is our emergency management team will work with the medical directors at the homes. They probably have private, we helped hook them up during the heat of this when testing was an issue with different labs. Some of them use LabCorp, some of them use Quest, some of them use Aegis, some of them use our, we have a local lab. And so they probably have a lab. What will be different now for the residents is the wastewater will trigger cause to test everybody, so then insurance will cover all of those tests. So this will then be a benefit to the management of the building, that this won't be a cost to them. This will be something that insurance will then cover.
Has there been any thought of doing saliva surveillance testing in the senior facilities, like asymptomatic testing, like what they're doing on a college campus?
Yeah, there has been. There's discussions about that. Again, as we get ready for what will be more complicated times related to this virus, as the weather turns, all options are on the table. It's about building that capacity up. And so this helps us at least, we're not going to be missing anything right now because of how sensitive this test is. But I think certainly we would love if Upstate gets the capacity more to take our asymptomatic program in schools and then be able to incorporate it into facilities, senior facilities. We would love to do that. That means we have to beef up our staffing and funding. Certainly, at some point may become an issue, but right now, certainly, we're going through our budget process, and in 2021, we have an opportunity to put in our budget dollars for testing and things that we didn't have an opportunity in 2024.
Ryan, any update on the furloughs, layoffs in the county?
Yeah, so we got last week, I think it was last week, we had 2 sales tax payments, both positive one very positive. We received more than the previous payment. And then the second one negative, but going in a better direction, which direct correlation with reopening of our economy. So for October and November, there will be no more disruptions to the workforce. I think we will get another November payment shortly after our budget address, and hopefully that's going in the right direction again. And if so, no more workforce disruptions. In 2021, we're working through the budget now and finalizing things. So we'll have our story to tell November 4th. My budget address will be primetime TV, I'm sure, for all of you. So we'll see you there.
What guidance is the county giving parents about Halloween trick-or-treating?
So I'm gonna talk to Dr. Gupta about specific things, but I think again, maybe a couple pointers that we can put out before Halloween. But certainly, I think some common sense things are gatherings with young people. If you can limit the gatherings, you limit it to families, limit it to people that are interacting with each other on a daily basis. That's good. Certainly, any resident that doesn't want to participate doesn't, you don't have to. You don't have to when you want to. So, or you just close the door, turn the lights off. People should know. But we'll talk to Dr. Gupta about some of the other more specifics if there's other recommendations. Certainly, we think it's something that people can do and do safely in a way to give the kids that experience. That's a fun experience for the kids.
Budget address the day after Election Day, huh?
I did not plan it that way, Andrew. The Ledge was very good to me. They allowed us to extend the budget process this year, so we had more data. Normally today, I would have already presented my budget, and so that week, for example, where we got good news, I wouldn't have known about the good news. So in my budget, I probably would have did some things based off of bad news. So time is knowledge in this pandemic. So that was a good thing that they gave us that flexibility. But I don't know. It could be an interesting day for everybody on November 4th.
What's your plan for voting? Are you going to do early voting, vote on Election Day, absentee?
Yeah, I'm going to do Election Day voting. That's traditionally it's something that usually one of my children likes to come with me and go through that process. So that's kind of a nice family tradition. I think, for the most part, the one thing is when it comes to voting, lots of options, right? And so people, no excuse absentee ballot this year. The early voting, 6 locations throughout the county people can go to. I don't think there's going to be big lines. And then on Election Day, I think you'll see more people just traditionally voting on Election Day. So I think, there's opportunities for everybody to do it from a public health standpoint. I think I wouldn't worry, if you were worried about it, you had the opportunity to get an absentee ballot and vote by mail. But the early voting sites, I don't think there's going to be big lines, and they're open on Saturdays and Sundays, and they differ. So, again, just wear a mask and make sure to wash your hands. I wash my hands all the time, and it helps you with COVID, but it helps you fight off some of these other seasonal flus and whatnot as well.
Any announcement on an endorsement? Can we expect an announcement on an endorsement?
For who?
President.
No, I'm not. We've talked about this a little bit. That race is a divisive race, and in my job, I have to keep people focused in on what we're talking about today. And I can't have some people, no matter who they support, looking at me as saying he's taking that position because of his presidential candidate. And I can't have that. Other elected officials they have the luxury of not having to do my job in a pandemic, and they can go and endorse whoever they want. And that's fun. But in my job, I cannot have people thinking I'm making decisions from this podium, explaining it to help a political candidate. So that's something that, and I'm very comfortable with my decision to stay out of it. People don't need elected leaders like me in a race like this. People are going to know who they're going to vote for. They don't need my 2 cents. Any other questions?